Emma,
Oh, hi. Can you hear me?
I can.
Okay, perfect. The camera's. Oh, there we go.
Here you go. Are you recording?
Yes,
Okay. Does your audio work in your recording?
it should. I'm also recording on my computer next to me in case for some reason the audio cuts out.
Awesome. Thank you.
Hello, my name is Emma,
This
and I'm going to
meeting is
be
being recorded.
the ASL interpreter for this meeting today.
Hello, I'm Dr. Nguyen. I'll be taking care of you today. How can I help you? What is going on?
One second, sorry, the interpreter is having some tech issues currently.
No problem.
So I experienced a dog bite on my arm. It was around 2 days ago. It was from a person that I didn't know. I was just walking, and a dog just came up and bit me. So, yeah, I'm not super sure what to do
Okay,
next.
and then were you able to stop the person and get information about the dog?
No, I didn't know who the owner was. They left before I could catch up to them and ask.
Okay. Was the dog provoked or it just ran up out of nowhere?
It just showed up fast, came out of nowhere.
Okay, and where did they bite you?
On my arm, on my forearm, my left forearm.
Okay. Is there any bleeding or redness?
It's not deep. It doesn't look. There is some yellow pus. I did clean it, but it looks like there might be an infection, possibly.
Okay. What the area? Are you having any numbness or tingling?
It's red and it's very sore. It's painful. You can see the little puncture bite from where the canine teeth, entered my skin.
Okay. Do you remember when your last tetanus shot might have been?
Around less than 12 years ago, maybe? Around 12
Okay.
years ago, somewhere
So,
around there.
unfortunately, okay. Unfortunately, with everything going on, I definitely do need to see you in person to assess the bite. Now, with the pus and the pain, are you taking anything like Tylenol or ibuprofen?
I've been taking Advil for pain.
And do you feel like the Advil is
Oh, and then
knocking
vitamins
out
as
the
well
pain?
for pain.
Okay. Do you feel like the medication is knocking the pain out for you?
It's slowly, yeah.
Are you having any fevers or chills?
I've been hot, sometimes I'm cold. It kind of depends. I switch between them both.
Okay. Any nausea or vomiting?
Not nauseous, or I'm not nauseous nor have I vomited at all.
Okay, so with everything going on with the bite and then the pus, there's two things that I'm worried about. We'll take the simpler thing first. With the dog bite, I'm always worried about infection. So I am going to treat you with an antibiotic. Do you have any allergies to any medications that you know of?
Nope, I'm not allergic to anything.
Okay. So the antibiotic that I would want to do is a skin antibiotic called doxycycline.
Just to correct my spelling, that is Doxycylin, correct?
Dycline.
Okay, perfect. Thank you.
And it's a capsule that you're going to take twice a day for 10 days. Any
Clarifier
questions
for the interpreter. When you say 2 times a day, do you mean 1 time in the morning, 1 time at night?
About every 12 hours, so it's usually after waking up and before going to bed.
Okay. Will I be nauseous on this medication at all?
There is a possibility that it can cause a little bit of nausea and an upset stomach, and the best way to fight that is to take it with some food. Doesn't have to be a full meal, but a little something to calm the stomach down.
Okay, a snack. Perfect.
So that takes care of the infection, but my bigger concern is because it was just a random dog that bit you and we don't know any information about the dog. I'm concerned about rabies.
Yeah, rabies. Okay.
Um,
So what do we do in that case?
Unfortunately, because you don't know the owner, is there any way that you can contact them? Is it a neighbor that you see very often? Anything like that?
No, I'm not sure who it is. I can't contact them. I live in a rural farm area, so I don't see a lot of neighbors.
Okay. Um, so I would actually want you to come in, and because we don't know anything about the dog, including their rabies status, I want you to get rabies vaccines and rabies shots.
Okay. When do you want me to come in for that?
I would want you to get in here as soon as possible. Ideally, within 3 days after the bite.
Okay. So I will go
Because we have
soon.
to
Got
get
it.
we got to get the rabies antibodies and the vaccinations in you just to make sure. There is a possibility that the dog didn't have any rabies, but the concern about rabies is there really aren't any symptoms until it's too late.
Okay. So rabies is a vaccine. And then do I also need tetanus as well?
Yeah, if you can't remember the last time you had your tetanus vaccine, that's also another vaccine we have to give you.
Okay.
Okay. Now, any questions about that? Any concerns about that?
Should I try to find the owner first if I can?
If you can, that way we can get an updated shot. If you can find the owner and you know that the dog is up to date on all of their shots, then we don't have to go the extra step of getting the rabies, but you would still need the tetanus.
Okay, perfect. Thank you. I will try my best to find the owner. Otherwise, I'll just go get
If
those
not,
2 shots.
yeah, come in to the clinic. We'll get the shots taken care of for you, and we'll get them ready for you.
Okay.
And that way we can also get a look at the wound just to make sure that there isn't anything else.
Okay.
And then what are you doing to clean the wound? Is it just normal soap and water, or?
So first, after the bite, I went back home and I used soap and water and I cleaned it up. I then, let me think. And then I used different cleaning, sterilized chemicals to clean that as well.
When you say sterilized chemicals, are you meaning hydrogen peroxide, or what do you mean?
Yes, first was hydrogen peroxide. Yes, sorry, clarify. It is hydrogen peroxide that I used to clean the wound.
Okay, I don't think you need to use hydrogen peroxide anymore, just soap and water, because it's not a deep wound, and I'm going to give you antibiotics. Hydrogen peroxide actually delays healing a little bit.
Okay.
Alright. Any other questions or any other concerns that you have?
No, not at this moment. I will go to the clinic to get those shots.
Okay. And hopefully we can find out the status of the dog, so that way you don't have to get the rabies shot, but you still at least need the tetanus shot.
Yep. Okay.
Alright. Any other questions? Anything else I can help you with?
No?
Alright. Well, with that being said, you guys have a good day now.
Thank you. Bye.
The recording has stopped.
How you feeling?
Okay, wait, how do I stop recording it now?
I got you.
Some.
You okay?
Yeah,
I'm okay.
I'm trying to figure out how
Yeah,
to
you can do
stop
it.
recording. Hi. I'm leaving soon.